Hello, 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 and welcome. Welcome. I made it in just the nick of time. Hello, who do we have in the chat? Happy Wednesday. We have Felicia Marie B. Hey, Felicia, how are you? We have Simply Taisha. She says, hey, DD, and Divalicious Fam. I love saying that, Taisha. Divalicious Fam. We have Mail to the B. Hello, Mail to the B. We have, who else do we have in here? We have Z. Hey, Z, how are you? We have Lakeisha. How are you? We have Mariella. Did I pronounce that correctly? Mariella. We have Harjareen. Harjareen, how are you? How are you? Well, today is Wednesday. I should be feeling refreshed because I feel like I haven't been on here in a while. But I am so feeling still kind of like tired. I need to catch some Z's, even though I've been sleeping good. I think I'm behind. So when you're behind, you're always trying to catch up, right? You're in catch up mode. So today, I was scrolling across the internet. I always say this, minding my own business. And I was kind of, just kind of struck by this article or this podcast I was watching, and they were talking a lot about, building muscle and what happens when we don't maintain or rebuild or kind of strengthen our muscle over time, especially as women, but also men. And so I came across this podcast and it inspired me to do a video, which I'm going to be releasing tomorrow. I've been working on that video for like 3 weeks. And it's so funny. I was telling somebody I've been working on the video and it's just kind of turned into a labor of love because I think I should have kind of kiboshed it and did something else. But I was so eager to talk about that subject because it really struck a chord with me. And then on top of that, yeah, I say, so many times in my video. And you guys probably don't hear it because I edit it out. But this, I had said it so many times, I couldn't edit it out so perfectly. So it just took me a while to I started to scrap it, I redid it. But anyway, so as I'm researching this video, I came across this article and it was talking about this weight loss. It was talking about the GLP-1 weight loss and how one of the biggest, criticisms of the weight loss medication and the weight loss part of it is that, people lose weight so quickly that they lose their muscle mass. And so one of the things they talked about is that Eli Lilly has partnered with this therapeutic company. And I believe the name is Juvena. Let me pull that up here. So Eli Lilly and Juvena are developing muscle boosting drugs that are designed to be used alongside your GLP-1 medications. And I thought, really? Eli Lilly? Eli Lilly is like, you're going to criticize that? Well, we're going to come back with a 1-2. So they've already invested billions of dollars on this. And it's really once it's, developed, it won't come out. They say for between 2 and 4 years. But, they said that about retatrutide and some of these other medications, and we hear they may be coming out soon. So, I thought this may be out sooner than we think, because this is one of the main things that I think holds people back from totally embracing the GLP-1. So we're going to talk about that today. That's going to be our topic. I always love learning something new. I'm going to try to make it a little fun, to get into this topic. We also are going to, I'm also going to share that drink that, I don't know if you guys were here. I don't know if that was a Friday live. I think that might've been a Friday live that we talked, maybe it was the last Wednesday. I think I haven't been live since last Wednesday. So we talked about, Mel B had shared a drink that she drinks with apple cider vinegar and seltzer water. I think it was like sparkling water. That's what it was. So anyway, she sent me the drink. She actually sent me a video of the drink, and it's not that hard. You just, pour the sparkling water and you add, the apple cider vinegar. And I always have apple cider vinegar on hand, ready to go. So, but I haven't tasted the drink yet. I haven't made it up yet, but I'm going to show you what's in the drink if you want to taste that. And then I'm also going to share, Linda's journey. We talked about on Friday. On Friday, we're going to be talking about some more things with dating, and we're going to be playing a little game with it, kind of making it fun. We're going to talk about Tracy Ellis Ross. That's a topic I had put off, and I think I've kind of made it fit into the whole weight loss genre. But if you've ever been interested in dating a younger man or dating a younger woman, younger woman or older man or older woman, we're going to kind of be talking about that. Um, so if you're married, I don't know, is your husband or your wife, they're older than you, younger than you. So we're going to kind of talk about that. Then we're going to put a GLP-1 spin on it. But we talked about, this was Darium's idea, is to use, which I thought was a great idea because I had been talking about her drinks anyway. But we were talking about Linda's journey. She's making all those great drinks over on her channel. So we talked about making a drink and bringing it to that live on Friday to, play our little game. So that's what I plan to do. Now, if you want to do this apple cider vinegar one with the sparkling water, you could try that too. So I'm going to show that at the end. And then I'm also, it's not lost on me that this is like Amazon week, right? What is it called? Amazon Prime Day. And I have a ton of things in my cart to buy. And I do have some Amazon affiliate links. So if anybody wants to try any of the supplements, or you just want to hear what the supplements I've always taken, I'm going to share those. I'm going to share the link to my little coldest water bottle. Everybody loves this water bottle. It's cool. And people always ask me about that because I take it to work. But I think I'm going to buy another one today. I'm going to buy it just to have one for work and at home because I feel like it's like exposed to germs traveling like that. So anyway, so that is on the agenda. So my first question to you guys, after I said a mouthful there, my first question to you guys is, would you take, now this is one thing I was wondering, I said, is this an injectable, this muscle building injection? So it's designed to help build your muscle. You're not going to lose muscle, you're going to build muscle, and you are going to take it if you decide, along with your GLP-1 medication. How much it's going to cost, we don't know yet. I think that probably would depend on how effective it is, but so far it's in the early stages and it's found to be effective. So my question to you is, would you take an injectable that is going to boost your muscle? Would you take that? Yes or no? Put your answer in the chat. What do you guys think? And I would have to say, I don't even want to take an injection that I'm taking now. So I don't know if I would do that. I am not sure. Okay, so she said, Grace. Hey, Grace. Hey, Allie. How are you, Allie? Bellflower, my twin. How are you? How are you? So, that's a great question. So I wondered, what are the side effects that you experience on that? So I'm going to share that with you because I had that same question. So I'll see what people say. Does it depend on the side effects? Does it depend on anything else? Oh, sorry. I was talking to my daughter. I see more people came into the chat. I said hello to Allie. I think that's how you pronounce that. Felicity. I love that name. That's a name I've never heard. When I don't hear names, it's kind of odd because I've been teaching for 31 years. So I've heard some names. Tanya, how are you? And welcome, Felicity Sea Monster. I love that. So let's see what people are saying. So would you take this injection? Allie is saying, hello, look how cute she is. Look at those hair and the glasses. I love that. I love the hair and glasses vibe. Losing it says, depending on the side effects. Mel said, based on positive clinical trial data, probably. Okay, Mel, I wondered that about you because you're all into the strength training and muscle building. Allie said, probably not. She said, probably not. Okay. Felicity is saying, hello to everyone. Welcome. Bellflower is not sure. Harjarine says she's not sure. Lakeisha says no. Tanya says flat out no. Z says that's pretty iffy. And Felicity says no. Okay, simply Taisha. Okay, wait a minute. We have depends on the side effects, said Felicia. Okay, that's good. That's fair. I would have in the beginning, but not now. Okay, Taisha, why do you say that? Why do you say not now? And am I the only wild child? Well, you know what, Mel? okay, so right now, you and I both, we've had DEXA scans, so our DEXA scans are looking good. I just hope mine maintains when I go back. But so right now, my DEXA scan is looking good, and I'm not losing muscle, right? So, and somebody said, that was my first one, but I feel like my first one was so good. Well, did I have a lot more muscle than that? I don't know. But anyway, my first one was really good. So if it continues to be that way, I wouldn't need it. But if I were to start losing muscle and I knew I was working out and giving it my best and I was still losing muscle, then I would do it, right? But if I was just, maintaining the way I am now, I wouldn't have a need to do it because I'm not losing muscle. Now, this is interesting though. Do you guys think somebody should do that instead of working out? Now, that'll be interesting because somebody might say, hey, this is great. I don't have to work out. I'm going to just take this, take this injection and I'm going to gain some muscle. I'm cool on working out. So I don't know about that. What do you guys think about that? Would you do that in lieu of, well, let's say everything was great and, the studies came back great. Would you do that instead of working out with the weights? Or would you, and let's say the strength is there too, because if you're gaining muscle, your strength is there as well. What would you do? So let me talk about the side effects, though, the potential side effects. So they say the side effects are in the early testing, the early stages. So let me tell you how early this is. So, basically they say you can reduce your lean muscle mass 20 to 40%. Now, I recently heard even as much as 50%. Taking these GLP-1s if you're losing weight quickly and you're not strength training. So this clinical trial is in phase 2, and of course, they started with the animals and then they moved it to the adults. And they said that some of the early side effects are injection site reactions, which I just had one when I took my 12.5 a month ago. I had the irritation. That's the first time I've ever had that in my history of taking Mounjaro. And then they say you saw the in site early the early testing shows injection site reactions of swelling, redness, and itching. Ugh. Which, like I said, I've had that. It went away though within a week. Then immune response, as many it says as with many protein-based products like that, your immune system may react differently to it, which isn't, if you have a great immune system, of course you don't want anything going wrong with that. This is an interesting one: muscle tightness or cramps. I don't know if you guys have that when you're working out. I have like a soreness sometimes, when I first do, introduce a muscle movement that I haven't, of course, the more you do it, the better off you are. So muscle tightness and cramping, and it says that's due to overactivation of your pathways. And then they say these are the unknown long-term effects, which if the study is new, they don't have long-term information, but they don't know how it's going to interact with your kidney yet, your liver, and how it's going to balance out your hormones, if it's going to do something to your hormone balance. So those are the possible side effects. The good news is so that is like what they, want to see what's going to happen long term with your liver, kidneys. Nothing so far has happened with that, but they say no serious adverse effects were reported in the preclinical trials. But the human data is still limited, right? They're still working on that. A lot of this data that they have solidified comes from the animals, so now they switched it over to the humans. So I don't know. Okay, so what are you guys saying? Let's see. Allie says, I would like to have more time before considering these new meds. Okay, yeah, absolutely not. Not another shot. One is enough. That's interesting because I was thinking that too. Like 2 shots? Are you kidding me? No, says Taisha. No, no, no. I would rather work out with the weights. Okay, nope, you're not. We do a lot of things, so you never know. Okay, okay, yeah, that's true. I'm gonna never say never. Remember, that's my motto: never say never. If clinical trials are good, I'd be open to a boost in muscle protein synthesis. Okay, all right, very good. Okay, all right, so that's interesting. Okay, I'm surprised you guys. Some of you guys are like, oh no. Okay, so here's another question for us to answer about this. I lost my little questions I had jotted down here. Okay, so where did I do with my questions? My research has taken over. Okay, so I want to know, do you guys know where your muscle loss is so far? Like, so I know in here, I know Taisha has had a DEXA scan, and it doesn't have to be a DEXA, even though that's the gold standard, they say with scans. You could get an in-body scan. You could have just had a bone density scan. I know insurance usually covers that one. But, how do you think you're losing muscle? Do you know you're losing muscle? What's up with your muscle? What's up with your muscle now? Because like I said, that's one of the, besides the fact that people think we're cheating being on a GLP-1, not everybody, but the criticism is that we're cheating. One of the other criticisms is that, losing that muscle mass, especially for women as we age, right? So, what's up with your muscle? What do you know about your muscle mass? Hey, Delilah, how are you? How are you? We're talking about your lean muscle mass. Do you know anything about yours? How are your muscles doing? And so you guys know my little DEXA scan, it came out great. My lean muscle mass was in excellent, in an excellent range. So I'm excited about that. I'm hoping to keep that up, right? I'm hoping to stay in that category. So we shall see. In August, I go back for another scan. And that would have been April, May, June, July. So about 3 or 4 months at time. So that I would have had since my last scan in April. So I'm excited to see what's going on with that scan. We shall see. Let's see. What are you saying? I love that. Not another shot. Thank you, Taisha. Don't forget to hit the like button. Divalicious fam. Thank you. I would continue to work out, of course. That's a lifestyle change forever, but I could always stop. Okay. When you say you could always stop, you mean working out or stop the injection? Hi, Delilah. I've been consistently gaining muscle since that initial loss. So yeah, and you guys don't know Taisha. She's a content creator. Most people here probably know, her, but she lost weight and she was just taking those pounds down and she went to, get a scan and she found out she had lost so much muscle. So she's been on a journey, a successful journey to gain that muscle back. So she's been gaining that muscle since her initial loss. So how much was your initial loss? Because it was kind of staggering, wasn't it? If I remember correctly. Paula, how are you? How are you? Limitless Living with Shanta. How are you? How are you? All right, so what are you guys saying? I've gained quite a bit of muscle, thank God, and I've worked hard to do so. Okay, very good. And you have. We love that, Mel. When I did my full body MRI, they said my muscle mass was pretty good, all things considering. Okay, very good, very good. Was pretty good. So I would get some numbers on that. Let's get some data. Here I am, the DEXA scan lady recommending everybody get a DEXA scan. And see how you should never say never? Because when I started out, I didn't want to get a DEXA scan. I was like, what do I need a DEXA scan for? And then when I started lifting weights in December, that's when and I have been doing some strength training things, at my bedside, in my room, the things you do, your own body weight. And, I had enough of it. So it was heavy, it was working. And so I really think that put me over the edge when I went to DEXA scan. That really helped me out because I have been doing those little things all along. So small things, like we always say, lead to big wins. And that was so true in my case. And when I added those weights, we're going to see what's going to happen. I started adding those weights in December. I had my DEXA scan in April. But so I'm somebody who said, DEXA scan. And then I was like, okay, I'm going to get a DEXA scan. I want to see what's going on inside my body. And that was one of the best decisions I ever made. And I think it's great if you're going to use the information and try to do something with it. Now, if you're not, you're going to be like, oh, whatever, but plus you're going to pay for it. So some of us pay a pretty penny. So if you're going to pay for it, you may as well take the data and actually use it. All right. So Mel says she could always stop the injection. Okay. I don't know what you're trying to say, so I'm not even going to try to read that. She says, oops, I will strength train forever. Love it, love it, love it. 14 pounds of muscle. Jeez Louise. You lost 14 pounds of muscle. Well, what in the what? No wonder you're on that, you're working out and you're on that walking pad and doing all the things. I love that. Very good. So she took that data and she actually used it. That's what it's for. I love it. Taisha, I need to tally mine up. Okay, all right, very good. So is that what that's what you lost? Because yeah, you got the emojis there. Geez, Louise, but now you are on the up, you turn that frown upside down. You do need to get a DEXA scan. We've been talking about that in the comments. So hopefully you'll get one. Um, it's a little bit of an investment. I want to do a formal DEXA scan, but haven't done one yet. Yeah, you have to do one, Delilah. I will have to pay for it. It's not covered by my insurance. Yeah, I had to pay. Mine was like, ended up paying like $270, and that was with 2 scans and a metabolic rate test, resting metabolic rate test. So, and that was like with the discount, like I want to say it was like a 10% discount or something like that. So anyway, my next one is already paid for, thank goodness, but I will have to pay, I think $85 if I want to get that other RMR, resting metabolic rate test. So, geez, Louise. Well, she says, Bellflower says, for me to get it now, it would simply be the gauge for me to watch my muscle mass increase over time. Okay, yeah, which is good though, because that's what you want. That's what you want. Christian, hello, hello. You are on week 3, 2.5 on Mounjaro, yay, a Mounjaro sister. And you're 8 pounds down. I love it. 3 weeks. That is awesome. Okay, let's give her some confetti. Let's give her some confetti. Cute profile pic. Oh my gosh, Christian, what a cute name. Look at you. You are too cute. All right, very good. I love that. Already, we got to win here. We got to win. So I'm glad you came because you're a newbie. And I want to ask you, don't feel pressured to tell us, but we kind of want to know. So are you exercising? Are you strength training? Are you doing any of those things, Christian? That's what we want to know. And that's okay if you're not, but we want to encourage you too if you're not. I'm just afraid I won't fit in the machine, but I will look more into it. I see them in my area with coupons for like $30 or $50. You know what, Delilah? I'm going to give you some confetti for that. You know why? Because I think a lot of people have that fear of not fitting in things and not taking the scan because of that and not really sharing that. So I'm glad that you said that out loud. You probably freed somebody else up who was having that hang up about fitting into the machine. And I'm going to tell you, as somebody who, got one, at the time I was 200 and how was I 241 or something like that. I can't remember exactly, but I was thinking that too. I was thinking, how is this machine? What's going on with this machine? I was thinking, am I going to fit in this machine? And I fit. So I think you would fit. I mean, it's really nothing it's not enclosed. Some of those machines are kind of like enclosed. It's not like an MRI. There's no point, I don't think, where you're really enclosed, but they do, you do go through something, but I think you'll be fine. I think you'll be fine. And actually, go to the place that you would have it, talk to the people and, talk about it. I love that for you. Love it, love it, love it. Okay, now that threw me off my track. Where was that? Okay, very good. All right, people are telling Christian congratulations. Hey, Bobby, how are you? How are you? Back from vacay, I believe. I love your videos. Thank you. Thank you so much. I appreciate that. I appreciate that. Now I have one coming out tomorrow. I want you to watch it. I think it's a good topic. But I want to know about this exercise. And you know what? Honestly, Christian, I don't know if you've been, really how far you've gone back with my videos, but I don't really like to exercise. So the fact that I'm even on here talking about it, advocating for people working out, I think that's just huge. That's huge for me because I don't even like to do it myself. But, it's a lot of things I do that I don't like to do that I do because I know I should. So an exercise is one of them. And hopefully, I like group exercises. I haven't found a group exercise with like my friends to go to yet. But I like the social part of exercising, but I haven't gotten that far yet. So we shall see. Okay, look at you. Everybody said congratulations. We love that for you. So you exercise 4 times a week. Are you strength training or are you cardio or both? How about that? Strength training, cardio, or both? And so, anybody in the chat, let me know if you had to choose one, this or that. Is it, you know, I think we've talked about this before, but just because we have a newbie on here, you know, so she can see, are you a strength trainer or are you into cardio? And if you do both, let us know you do both. And I would put in that, for me, myself, I would put both. But if I had to give one up, okay, so let's put, so for right now, I'm going to just say both. And let's see what you're saying. So Christian says she goes for a walk on Saturdays as well. Very good. 4 times a week and you walk on Saturdays. I love that. Just bought what's that, Hume's body comp scale. It says it compares to the DEXA scan. Yeah, but you know what? And I don't know about that one, but a lot of them say that and they're not accurate. So you know how you're going to know is you're going to have to go get that DEXA scan or an in-body scan to compare it. Or I would say the DEXA scan though to compare. But I think that's great. I think that's a great, great start. You're doing all the things. Most machines have a range of 250 to 350 according to Google. Love that Google. Thank you, Simply Taisha. Well, thanks for the info. I'll definitely reach out to them. Yeah, I think you should go. I love that. I love that you shared that too. That that kind of warms my heart because I think you freed some people up or will that were having that hang up. Yay. Yeah. You do both? Okay. So strength train first for sure. A little cardio. I have both in there. Both 3 days, strength training and cardio. Okay, very good. Felicia says both. You prefer strength training, Z says. Mariella, more cardio. Okay, okay. Kim J, Sweet Healthy Life. How are you? How are you? All right, Lakeisha says cardio. Taisha says both. I do both, but heavily strength focused. Okay, very good. And let's see, we have Simply Taisha, strength training and walking. Okay. Christian says yes, she wants to. You know what? This is another tip early on. You know, it will help you. I'm telling you, if you can, you know, invest in this, I would get a DEXA scan or an in-body scan earlier. So I don't really have regrets. But if I did have a regret, you know, that would be one of them. That wouldn't, you know, that's on my list of regrets if I had a 1 through 10 or something. But I wish I would have got a DEXA scan when I first started, right? When I first started. So you're so early on in your journey. I think you should invest in one within the first, okay, you're already almost a month in. So by month 2, no longer than month 3, right? Because every 3 to 6 months, it's kind of nice, or, you know, a year, you know, whatever you want to do. It's kind of nice to see like what you're doing with that muscle mass and that your bone density, because I think it's important so you can catch it early, right? While you can. So that's just my little 2 cents. Get that DEXA scan. Hello, everyone in the car, so I can't comment after this. 100% strength if I could choose one, but I do both 5 to 7 days a week. Healthy Spirit Podcast. Yes, yes, yes. You have been working it out since day one. I remember that. Quick question. Has anyone ever traveled, flown with their shot? Is it allowed? I think it definitely is allowed. I know people put it in a special container. I have not. So that's a great question because I'll be traveling soon with mine. And it's we have those Amazon Prime deals, so maybe I need to pick up something to put that in there. So help us out. What could we put ours in? Walking mostly, but started some strength training last week. Okay, very good. I think that walking and strength training is it's like a 1-2 punch combo. Strength and cardio. Yes, yes, yes. I work with a trainer twice a week and 2 days on my own. Oh my gosh, you are doing it and doing it and doing it well. She's doing it and doing it and doing it well. Christian, you are crushing it. I love that. I love it. You know, a lot of times, and not, just the people that I talk to, there's so many people who are on these meds that I don't know. But a lot of times when you have newbies, they come in and they're just like I was. I was one of those newbies that start and I just didn't know a thing. I was just winging it as I go. And so I love that you came in prepared, like you're prepared for this journey. Great mindset. You got a trainer. You are on it, on it, on it. Love that. Thanks for the information. That's great to know, Taisha. Beautiful people. Don't forget to like and subscribe. Thank you. Thank you. No problem, Delilah. I hope you're able to get one soon. They are super helpful. Yes, 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 for sure. Paula says, I'm in physical therapy right now for a neck injury, and my personal trainer has me working with weights. I honestly don't like strength training, but I'll make myself do it. Walking is no problem. Yeah, I understand that. I'm kind of like the same way. Like I don't, I make myself do it, but I'm not a fan as of yet. One of these days, I hope I'm out here saying, I love to work out now. And when would that be? I don't know, but I'm doing it. I am doing it. Yes, Christian is doing awesome, awesome, awesome. Limitless Living with Shanta. I love how I say her name. Limitless Living with Shanta. I intentionally took a flight with my injection just to see how it would travel. It was perfectly fine. I just told TSA I had an injectable medication with me. Okay, so you have to tell TSA because I have one of those, where you can go through the line rapidly. I have one of those, I don't know if they're not credentials, but passes, whatever it is, where you got to arrange that. So I was wondering about that too. I was wondering, yeah, so that's good to know. So tell them that that's in there. And what did you put it in? Like what case? TikTok Shop has a travel kit. Okay, we got to go to TikTok Shop. I just ordered something from TikTok Shop. That's funny. Beverly says, hi, Dee Dee. Beverly, how are you? Look at you. You are just so fabulous. Look at her with that new, updated, and new and improved. Not that your old ones needed improvement. Profile pic. I just love it. Love it, love it, Bev. You are so fabulous. You are welcome. Limitless Living with Shanta. Yes, I have traveled several times with my meds. It's allowed. I do bring a copy of the packaging showing it's my prescription, but no one has ever looked at it. So it probably comes up on that monitor, And you're not putting this overhead. Are you putting this under the plane, or is this also in the bag that might go in the plane, on the plane with you? What about that? Let me write myself a note because I wanted to buy a couple things tonight when I get off of here on my little Amazon Prime. So I'm going to put a Traveler. What is it called? Traveler something. And then I want to order, okay, a couple things. Look at me. Look at me shopping. So yeah, I want to make sure I get the traveling thing because I don't have anything to travel to put mine in. But you know what? I might not. Should I take mine just in case, like an extra? Because I will take it before I even leave. So I don't even need to. I don't even think I need to travel with mine because I'm not going that long where I would need it. So I just thought about that. Maybe I don't need to buy one. Okay, Limitless. Yes, it's acceptable. TSA is very accustomed to injectable meds. Plenty of folks travel with insulin. That's true. And other meds. Good night, all. See you in the next live, hearts. Oh, bye, Mariella. Mariella. I love that. That's not the lady I was jacking up her name, Taisha, the last time, and you helped me. I think I got it now. Mariella. Delilah, TSA website does say that it is advised to let them know if you're traveling with injectables. I did use a travel case. It worked out perfectly fine for me. I don't think I needed it, but I did. But you did it. Okay, very good. Very good. Bobby said, oops, I have never told TSA that I was traveling with injectables, but you got where you were going, so you're good. No need to travel with it if you don't need to. Yeah, because I know I heard somebody saying, well, what if I got stranded, or what if I didn't make my flight? I think I'll be fine. I also kept it in my carry-on because all medications should always go with you personally and never checked in your bags. Good point. I didn't need it. I did it to test it out and do a video on it. Okay, very good. Very good. Christian says she's been working with the trainer since March of this year, so before the Mounjaro. I was going to ask you that too. I wonder. I used to struggle with strength training, and I decided 2025 I will be consistent in the gym. Okay, very good. I love that. Bye, Mariella. Dee, it's a travel GLP-1 travel kit off Amazon. I have one in my basket. I'll send you the link to it. Okay, thank you, Beth. Funny, I didn't travel with mine, and then I got stuck and had to take the shot 2 to 3 days late when I returned home. Only time I ever took that you were off your medication. Yeah, so did you you didn't travel with your, she got stuck. That's what I was wondering, Kim. If I get stuck, that's the only problem. You never know. Flights may be late, and I'm going in Texas. Geez Louise. Mel is saying true, Kim, and Christian, I love it. Dedication. Yes, it is dedication. Okay, so let me ask another question. Let's see. This is a good question because I don't know. I don't ever hear people talk about this. Has your doctor ever talked to you about muscle loss and preserving your muscle? You could just say yes, no, or whatever you want to say to that. So that's the question. Has your doctor ever had a conversation with you about muscle loss, preserving your muscle? And I'm going to say, unfortunately, no. Why not, doc? Why not? Jeez, and so many no's are coming at me so fast. Isn't that unbelievable? This is unbelievable. What is going on? All right, so we get Devin, the guy in here saying yes. Now, isn't that ironic that the guy says yes? Jeez, Louise, I wonder is that because you're a guy that they said yes? Okay, so we have Downsizing Diva, a big no. I should have put caps on that. No, Harjarine. Bellflower, nope, no. Jeez, Louise, no. And we got the man with the yes. Nope, no. And she says, Christian says, thank you. My doctor did at the beginning before my first shot. Okay, very good. I'm even impressed by that, Shanta, that your doctor talked about it. My nutritionist has talked about it. Okay, very good. Well, at least somebody, because you made a drastic change. Okay, all right. So that's why they talked about it. What was your drastic change? Your bariatric surgeon talked about it and stressed the importance of protein and strength training. Interesting. Before the surgery or after the surgery or both? I guess I'm wondering before, after, or both. Interesting. No, you learned about it with your GLP-1 community. Yes. Me too. No, just about general exercise. Taisha, we said, has your doctor ever questioned you about I talk to you about preserving muscle, maintaining muscle, anything with your muscle. Yes, my primary OB and orthopedic surgeon all talked with me about it. Okay, very good. So you have an orthopedic surgeon. Why do you have that? I'm just curious. Um, that's great. It's a specialist that you don't hear a lot unless people have like falls or hip replacements or something like that. I don't really ever hear about it. He just said to keep it up. Muscle is important. Okay, all right, very good. Both. Okay, very good. So before and after the bariatric surgery. Yes. Okay, so doctor walked over to me after I lost significant weight. She literally lifted up my arms and giggled the far and said, you need to strength train yesterday. What? Oh my gosh. So that little part that jiggles right here, she did something to that. Look at, can you guys, I'm not going to show my jiggly, but I have some. And she said, you need to exercise ASAP. Jeez, Louise, talk about bedside manner. Oh my goodness. I am in San Antonio, Texas, and they are on it about mentioning about muscle mass loss. The main reason why you're sticking to your strength trainer. Really? They are on it. I wonder why in Texas. I don't know, maybe because people are showing more of their skin, but you would think Florida would too. Taisha, your doctor had two before GLP-1s or since you started losing weight? Um, yeah, Mel, that's not the doctor. That's not the doctor you have now, right? That's the one before that you had to fire. Is that the one you fired? The new, what is that? Myostatin inhibitors do not strengthen the joints, tendons, and ligaments, and the muscle it makes isn't good quality muscle. Okay, all right. I don't even know a lot about what that is. But can somebody look up, tell me, what is he saying? What is that? Myostatin inhibitors. What are those? They do not strengthen your joints, your tendons, your ligaments. Okay, very good. People are saying, oh, wow. So she jiggled the fat male. Oh, no. My daughter loves to do that to me. No, ma'am. No, ma'am. Go, Liv. Go, go, go. Let's see. Z says, Mel B. Oh, hey. Okay, stop, Liv. Okay, she said, it's the doctor I have now. I respect that. Okay, so that's your doctor now. Okay, okay. Christian said, Christian, I hope, no, Delilah says, Christian, I hope you were not impacted by the Guadalupe River floods. Yes, we've heard so much about that. So many people have perished. So many people are missing. I'm so sorry about that. Yeah, I can't believe that. I thought, geez, Louise, these people were camping. That's the first thing I heard about the girls that were camping. So yes, thank you for mentioning that, Delilah. I love her, the audacity of it all. You love her audaciousness. Oh my God, what a word. Those are new muscle drugs. I don't know if it was talked about yet. I got here late. No, we're talking about this drug that's an injectable that's it's like in the making with Eli Lilly and a company. It's not out yet. So these muscle drugs you're talking about are out already. I haven't heard about them. You also take Creatine and a GNC GLP supplement powder that has muscle support and fibratus. What's it called? U theory. Oh, I've never heard of that either. So you take Creatine. Okay, so has it helped you? Are you retaining water? I hear a lot of criticism about the water of it all. I'm not going to take Creatine at all until I talk to my doctor about it first. But, I have a feeling she hasn't talked to me about muscle. So what is she going to say about this Creatine? Don't know. Geez, Louise, but I also go to my gynecologist who is very well informed about all things related to this topic. So I'm going to be chatting with her. I promise y'all, she's a sweetheart. She's an advocate for her patients, Dr. Tiffany, and she's responsive. Okay, very good. So if you like it, you like somebody to give it to you straight, then you got to take it straight. I guess that's, go ahead, go for it. Christian, my son Lacey, Lacey, my son lives in San Antonio. How about that, Harjarine? Um, okay, so my myostatin inhibitor blocks the activity of myostatin, which is a protein that normally limits muscle growth. Okay, so it blocks that protein that limits the muscle growth. Okay, all right. This is for the serious weight loss enthusiast. I love that. Limitless says, "Oh, I have a pro tip for skin while strength training and losing weight." Yes. Have y'all heard of fascia blaster? Amazing. No, what is that? Now I gotta look that up. Can somebody look that up? I'm interested in the pill form of GLP-1. Not sure when that will be available. I think that's coming out the beginning of next year, 2026. So I think like that early first quarter, which would be, if you're into stocks, January, February, March, those first 3 months, April. I think it's going to come out then. They were saying it was going to come out later, but they're trying to fast track it. So that's pretty cool. I'm interested in that too, but not until I get to my maintenance. Like when I get to maintenance, then I would be more open to that. I am in the heart, unless my insurance tells me I need to be booted off the injectables and go to the pill, that could be. So Christian says, I am in the heart of SAT Kerr County. It's an hour away. Thank you, everyone. Oh, okay, very good. Oh, San Antonio, Kerr County. Okay, very good. I'm not good with I'm not good with acronyms, but I'm trying. I also take Creatine daily, 5 milligrams every single day. Repeat every single day. Repeat every single day. I love that. All right, Devin says patients taking Eli Lilly's Bimagrumb is in combination with Wegovy lost more fat and retained more lean muscle mass. Okay, all right, very good, very good. And I don't even know what that is. Can somebody look that word up? What is that? Or Devin, you can just tell us. What is Bimagrumab? Bimagrumab. And isn't fascia blaster a 2 like a GHA? Is that supposed to be shot? Paula, mid 2026. See, I was very close. I think it's going to be closer to the first quarter. They've moved it up. They're going to move it up again, Mel. First quarter, if you think of quarters, dividing out your year, it's those first couple months of 2026. I'm also a Creatine girl, 1 scoop daily since December 12th, 2024. Okay, all right. Thanks, Devin. If you work out regularly, the water won't retain. Creatine protects the muscles. Okay, if you work out regularly, the water won't retain. Okay, all right. But is it true for everybody or is it just true for some people? Christian. Paula, there's already a GLP-1 pill. It's called Rybelsus. Yes, but I thought she was talking about tirzepatide, so that's why I didn't say that, because I did take Rybelsus before. It is, I should have said that. Thank you for reminding me. But yeah, I took Rybelsus before I started on my Mounjaro journey. And it did not agree with me. But Rybelsus, I think it's great. If you need to bring that A1C down quick, fast, and in a hurry, it does that for sure. And some people can handle semaglutide. I heard it was called semaglutide, tomato, data. So however you pronounce that, it just didn't agree with me. So, hopefully if my insurance ever tries to boot me off of this Mounjaro, I'm going to have that data to support that Rybelsus, which is semaglutide or semaglutide, didn't agree with me. All right. It's a tool, she says. They have different sizes. I do plan to do a video soon, hopefully. Okay, very good. It's a tool. All right. I love that. Yes. Slim's in the making. How are you? How are you? Pill form isn't as effective due to a lower absorption rate. Yes, but you know what? I felt that pill. That pill had me nauseated. I was nauseous. I was tired. It just did not agree with me. I felt bloated. Like I felt none of that. And this was on, I tried the lowest dose. It's like a 7. It's a set. I had it here with me. I must have put it away now, but it comes in 7, 10, 3, 7, and 14, I believe. So that's next jump is doubles. And actually they're working on a higher dose than 14 milligrams. And so, I tried all the doses. I mean, they all made me feel that way. The 3 wasn't as bad, but of course you go up and geez Louise. So yeah, it is. That's the disadvantage of a pill, that it doesn't absorb as fast. Think about taking like a, Advil or Tylenol, the liquid gels versus the pill. But yeah, I felt it. It was a doozy. It just was uncomfortable for me to take that. Let's see. Okay, thanks, Mel B. Eli Lilly websites gives biohazard container for free for our needles. Yes, I saw that. I think I want to say, wasn't that Beverly that sent me that link? And I forgot to share that, Beverly. I think Beverly sent me that link talking about that. I don't know. Okay, Slim's in the making says creatine. What's that calling? Creatine. I was calling it creatine. Creatine. Okay. All right. Very good. Thank you. You're gonna have to do it. Help me again, because I will mess up these medical names in a heartbeat. Okay. Creatine raises intracellular water, goes into lean mass, and actually makes you look leaner and better. It has numerous sleep and cognitive benefits also. All right. Devin, are you a personal trainer? You need to be a personal trainer because you know all things related to this muscle loss, fat loss, what to eat, what not to eat. Okay. I'm talking about the new pill, not Rybelsus. I can't take that form. Okay. So I thought you were talking about the what's it called? Or Florgaton, the Eli Lilly pill coming out. Christian agreed, as long as you're not loading doses at the start of Slim's in the making. Creatine, right? It's very nominal, like 0.2 pounds, and it simply hydrates the muscle. It's not bloating. Funny how fallacies spread fast. Okay, okay. Well, Christian knew about that too. She brought that up as well. I think at first it retains water until your body gets used to it. So let me ask you, Christian. So do you take it every day? Because if you were taking it, like, let's say you're just taking it 3 times a week, is it going to have the same effect as taking it every day? Would it maintain more water in your muscles? And I'm only asking because, I was thinking about taking it, but I don't think I'm ready to take it yet. I think I don't know. I'm going to type in Google. Let's Google it. How much should you weigh trying to take some creatine? Because I weigh in the 230. Should I be taking creatine? I don't know. I don't know. Mel and Taisha inspired me to be a creatine girl. It's been amazing for strength training. Okay, very good. And are you finding yourself retaining water, retaining muscle? Retaining water, retaining, is it holding those pounds back from the scale? Okay. Hey, Dee Dee, not able to be here due to a family emergency. Well, thank you for listening in, and I'm sorry about whatever's going on. Praying for you over there. Sending positive vibes your way, Mary. Oh, I'm sorry about that. Delilah says, I see. Can you guys wish Mary and her family well in the chat? If you can do that, that would be helpful. I see Paula. Hopefully they will be effective for you. Yeah, I know. Well, you know what? I think a lot of people are thinking about switching over, Christian agrees with Mel. Right now, I'm on 15 milligrams of Mounjaro. That's the highest I can go. So you got up to the 15. Okay, very good. Mark Clem! Yes, yes, yes. How are you? How are you? Great profile pic. Oh, that's the Downsize profile pic picture. Oh, I can't really see your wife, but look at that. I'm sure she's a beauty. Love it. I love these profile pics. Welcome, Mark. Welcome. Creatine isn't just for muscle growth, it's also very beneficial for our brain. See, I heard also that if you were that's why I'm going to wait and talk to my gyno, because I've also heard it's good for perimenopause, if you're having, hormone, imbalances, all of that. So yeah, more than just the muscle, which is great, right? Male says people lost 15% over 36 weeks on orforglipron in the trials. Pretty darn good and few dropouts. Very tolerable, unlike oral semaglutide. Yes, that's semaglutide. I'm telling you, that bad baby. I don't know what's up in there, what it was doing, but I could not handle it. When I tell you I could not function, I could not. But interestingly enough, my A1C went down, down, down. It really, really did. So I will have to give it that. Interesting regarding the pill, goes to show you that everyone is different. Yes, I know. Isn't that so true? You take creatine too. Okay, very good, very good. And so, Mark, have you noticed that it's helped with your muscles? Has it helped? Do you feel stronger? Do you feel a sense of more clarity? What is it doing for you? Do you believe the creatine? I take my last 2.5 on Saturday. You titrate up to 5 milligrams. I got my box yesterday after your doctor's appointment. Yes. Now they say that 5 is what's up. That 5 is where it's at. And I will say for me, it was too. But I wouldn't have told you that until I went back and looked at my data. So, I keep track on a calendar of, what's going on, how much weight I lost when I switched, since the day one. And I haven't really done a good job of keeping up with that as much, but I'm documenting it on video. That's probably why. So I need to go back and transfer that to my calendar. But yeah, so I was like, 5 is okay. I did better on 2.5. I actually did really well on 5. I didn't realize it. Thank goodness I had written it down, because now I had to go back and correct myself. Like, it really was better than I actually thought. Okay, all right. So Mel says, Devin, thank you. Any diabetics in the chat currently taking creatine? No, I am not. So I don't know. Anybody else? Mark is saying hello. Mabel, hello. She's from California / Missouri. Well, welcome. Glad you came in the chat. So, Mabel, tell us, Maybell, I said Mabel, Maybell, I see that L now. Maybell, tell us, So are you on the GLP-1? What are you taking? And tell us, are you worried about losing your muscle mass? We're talking about all things muscle mass, strength training. Last week we talked about food, but that's also important if you're, trying to gain that muscle as well. Yes, Dee Dee, I did send you the link to the free sharp container. Yes, I remember you sent me that now. I didn't do anything with it at the time, but maybe I'll post that. Be sure to let your doctors know about any supplements you're taking. Yes, yes, yes. Please do. Please do. I would definitely talk to your doctor. Remember I said that, Taisha? I just said I'm not taking creatine until I talk to my doctor. Devin says creatine is a top tier supplement, 5 milligrams daily. The research shows that higher. And you know what, Devin? I read that was the highest, not the highest, but that was the most researched supplement on the market, creatine. So that just goes to show you, that data is real, right? It's research. It's kind of try and true. So before you take it, and before you even talk to your doctor about it, I would do some research on my own, take it to my doctor, and go from there. Thank you for sharing that. The research shows that higher than 10 milligrams shows promise for sleep deprivation. So if you go higher than 10 milligrams, okay. So if you stick to around that 5, you should be good. I thought EL discontinued their Sharps container program. Glad to hear it's back. Now, Bev did send me this a while back, so maybe, I don't know. We'll see if it's gone or not. I don't know, Bev. Is it gone, Bev? I take it when I work out only. Okay. All right. So on the days you don't work out, you don't take it. So is that a good thing to do, Devin and Mel, Taisha? Should you be consistent, or is it okay, like Christian, to just take it on the days you work out? This is a good discussion on the creatine because I have it in my basket for the Amazon Prime, but I don't know. Taisha, yes, so true. All this talk about supplements, hashtag not a doctor. Well, we always tell people though, talk to your doctor. When we suggest things, not to run out and buy. You always should consult with a healthcare professional. Prayers for Mary. Yes, thank you, thank you, thank you. Darium, where art thou? Where art thou? Darium is in the bushes. Darium needs to come in here and talk about his muscles. I didn't have any water retention when I started, thankfully. Okay, very good, very good. Thank you, Lakeisha, for Mary. I retained 2 pounds for 1 week and then started losing weight normally again. Okay, very good, very good. Praying for you, Mary. Thank you for that. Okay, Mel did not either, Taisha. You said sorry, you meant in grams. Okay, thank you. Hey, Maybell, I'm in Missouri. You're in Missouri too. How about that? What a connection. I love that. That's amazing, Felicia. Mary, I pray that all goes well with you and your family. May God cover you and keep you. Yes, yes, yes. Ditto to that. Wait and talk to your doctor. I talk with my primary first. Yeah, I think that's great. The information is out there now. If you decide to take it, great. If you don't, that's okay too. We're just putting the information out. It's up to you and your doctor to go from there. Hey, fam, Mayor Mindy. She says, popping over from the downside. How are you? How are you? I go to my OBGYN. I love to say the YN. Next week, we will discuss with him you will discuss that along with getting your annual labs to check for menopause. Okay. And I'm going in September, twin. I'm going to have to call you. Hey, Mindy, she says, hi, Mindy. Thank you, Mel. Okay, let's see. People are saying hello to Mindy. Voyage to Wellness with Anissa. Did I say it right? Anissa, I love that. Voyage to Wellness. How are you? I'm on 5 milligrams. You start your second box on Friday. You have not lost an ounce this week. Okay, that's okay. That's okay. Now, this is when we hold on to those non-scale victories. So you're on 5 milligrams, and that's your second box. Okay, that's okay. That's okay. Stay in there, do all the things, and it will slowly but surely, it's going to creep back down that scale. So don't give up. Don't give up. I love that. I'm going to give you some confetti. Thank you for sharing, coming in, sharing. And let's ask Anissa, are you exercising? Are you strength training? Because we're trying to really promote that. We're trying to come in strong for the ladies and the gentlemen in 2026. Just imagine how we're going to look in 2026. It's not far away. Just about 6 months. Praying for you, Mary. Thank you, Slims. And I'm making. Thank you. Thank you. Okay, she says, doctor told me 5 is the sweet spot. Yes, they were impressed that I had lost 8 pounds so far on 2.5. Yes, that's what I hear. 5 is that sweet spot for most people. And I think most people don't believe it. But when you get up to those higher doses and you're not losing like you think you should, people think like, I want to go back to that 5. 7.5 did not do I was disappointed. I thought because 5 was good, right? And I thought 7.5, you're taking it up a notch. No, I didn't really have like some good results again until I got to 10, and then that teetered out, and then now I'm on 12.5. So we'll see how that goes. I'm just a slow and steady loser, and I'm okay with that. I'm okay with that. Creatine, like everything. Shit, Slim's in the making. I think I got it right. I've been saying it like it's just flowing out of my mouth. Creatine, like everything else, are beneficial to some and not so much for others. For instance, people with high blood pressure that have water retention, it may not be beneficial. So, what are you people in here with the creatine? What do you think about that? What do you think? If you have high blood pressure, you're retaining water. Do you think you should even give it a try? Now, we know we should ask our doctor, but did your doctor mention anything about that? Great point, Kim J. Sweet Healthy Life. 5 milligrams has been the magic dose. Oh, yeah, because you're still on 5 and maintaining on 5. I think I'm going to be one of those folks, maintaining on 15. Mark says, I think it has helped me in strength for sure. Not sure about the mental side. I still forget why I go in the room. Well, I don't know. How long have you been taking it? That may take a while. I'm doing that too, Mark, and I'm not on creatine. I just think that's like age and, all that goes on. Let's see. Hey, California here too. Okay, very good. Bellflower, I asked Dr. Dan if type 2 diabetics can take creatine, and he said yes. Okay, all right, coming from Dr. Dan. All right, all right. My Renfo scale says I've lost over a pound of muscle. Maybe that's why I'm not losing this week. So you lost muscle. You don't want to lose muscle though. That's not what we want to do, was lose that muscle. Okay, but are you losing quickly? Voyage to Wellness with Anissa. Are you losing quickly? Because that may be, that may be why. I am diabetic and Mounjaro has helped my blood sugar and blood pressure. Me too, me too, me too. So I'm diabetic, pre-diabetic, and then I was high blood pressure, normal blood pressure. I love that. That's a great non-scale victory. Let's give some confetti. Let's give some confetti for that. Love it, love it, love it. Very good. I just love that you're a newbie doing all these great things. That is so inspiring. For even me to get my buns moving. Okay, so she says, Bellflower, this is my 3rd panel. Low luck so far. Anxious to get rid of my monthly bestie. Okay, yeah. Well, yeah, we might be having my menopause party here soon, and everybody's invited. Guys, girls, everybody across the YouTube land, you're invited. Delilah says, that's amazing, Christian. Congratulations. I love that. Margie, hi, Margie from Delaware. Delaware, I love that. Type 2 on Mounjaro. This is week 15, 7.5 milligrams, 19 pounds down. Still learning thanks to this community. 19 pounds down. We love that. Okay, let's give her some confetti. Yay, Margie. Oh, look at that beautiful profile pic. Look at those braids. Love it all. Love it all. Thank you for stopping in and sharing that with us. Wait a minute. Hold up. Wait a minute. Slim's in the making. Oh my goodness. You said you mastered creatine. Thanks to you. I love that. Okay, let me give you, you are so sweet. Let me give you a you said give myself some confetti, so here I go. Yay! I did it. I did it. Creatine. I love that. And I'm a teacher too. When you're a teacher, you should be a lifelong learner, I always say. And I love learning new things. Thank you for helping me. Okay. Yeah, thank you so much. Okay, where did I leave off? Okay, let's see. Okay, so with Margie from Delaware. Okay. Because I'm a diabetic, my Mounjaro through my insurance, I paid $0. You got Cadillac insurance? No, you got Cadillac insurance. I was about to say, no, you got Mercedes Benz. You can have Mercedes Benz insurance. You pay $0. I love that. I don't even pay $0, and I got some good insurance. They say being a teacher. Jeez, Louise, we gotta give you some confetti for that insurance. Oh my goodness. Very good, very good. We love that. Okay, all right. You got to keep that insurance. You got to keep that insurance. All right, very good. Let's see. Kim says, no, Nicole, I'm not taking creatine. My endocrinologist and nutritionist said I can, but to make sure it's a clean brand and only workout days like Thorne. Talk to your doctor if you're thinking about it. So didn't you? I don't know. I can't remember, so I could be wrong. Kim, didn't Mel share give you some creatine, and did you take that? I don't know. I could be wrong. I thought she gave you some creatine. And did you ever take it? Maybe you didn't. Okay, all right. Christian, Mounjaro has lowered my A1C from 6.8 to 5.5. So thankful. Oh my goodness. Love it. So you're in the normal range too. Very good. Very good. I love that. Great job. Don't you feel accomplished? That is like an accomplishment. I love that. I take it daily. It is a build up over time type of thing. Okay, you take it daily. It's a build up over time. Okay, all right, very good. Kim is saying, awesome, Paula. I mean, Paula, that is awesome. Darian, disclaimer: the Downsizing Diva is caring, compassionate. She content creator. She is not a doctor and does not offer medical advice. Check with your docs for your plan. Yes, yes, yes. Oh, it's Darium. Thank you. People are saying hello to you. King Darium has arrived. WV, how are you? How are you? Come on in. Come on in. Very good. People are saying congrats. I love this. Emerges from the bushes. All right. Mel says, my doctor said 5 milligrams daily. That said, I've had a few days off here or there. Forgot to take it while traveling. Daily for me, it's helped me put 11.7 pounds of muscle on since July of 2024. Yes, yes, yes. Awesome, excellent, awesome job. Let's give you some confetti for that. Very good. All the creatine people, Taisha, when I see her name, I'm gonna have to give her some confetti too. All you guys taking that and being, just consistent with it. I love the consistency. Um, let's see. I'm just scrolling. Mel, you are always riling Darium up. He comes out of the bushes. Yeah. Darium is hilarious. He summons you and shows out of those bushes, Darium, they're telling you. Oh my God, people are asking how you've done. Okay, so Voyage to Wellness says, I have not done much strength training at all. Okay, all right, very good. So are you doing cardio and you're just not into the strength training? Because I would talk to your doctor, but I would get that started. I would get some of that strength training started in there if you can. Now, if you don't want to, don't, but I'm just saying I think you should, because if you've already noticed that you've lost muscle, you don't want to continue on that path. I can't believe anyone would ask me when I'm not in the Oh my goodness. Geez, Louise. Mindy, you cannot be a troublemaker over here. You guys have to be on the straight and narrow. Bobby says, I think 5 milligrams might be my sweet spot, even though I've only been on it for 3 weeks. Very good. Very good. I love that. So I think if you can stay on that, if you're doing well, to try to stay on there, if you're feeling comfortable. I love that for you, Bobby. 5 milligrams. Yeah, 5 milligrams is the sweet spot. All right, let's see. Kim said, I agree about your comments of Dee Dee's characteristics. Oh, thank you. Mindy says 5 is the sweet spot because after the loading dose of 2.5, that's the dose where you still have the most to lose, so you lose more quickly in general. That makes perfect sense, Mayor Mindy. It actually absolutely does. Actually. All right, so let me ask you guys. I see we have some more comments in here. Somebody is saying, what are you saying? Thanks, Darian, for your gladness and for reminding us that Dee Dee isn't our doctor before I embarrass myself by asking her to read. That is too funny. Yes, people are saying, talk to your doctor, talk to your doctor. We've been saying that all the way through. You guys are so funny. If you were to ask me to renew your Zepbound, we try to put that baby through. We get a prior authorization. I'm just joking. I would not be able to help you out with that. That is too funny. Okay, very good. Okay, so let's do this because it's already an hour. We're already an hour and 10 minutes in, I think. All right, so let's see. Let's do this. Let's play a little this or that. All right, so I'm going to ask you guys something. I want you to put your answer in the chat and then we will talk about it. Hey, my daughter always wants to play these games. These are adult games. She thinks she's on a weight loss journey, and she is not. You are not on a weight loss journey. Okay, so. Okay, all right. So which this or that? Which one are you gonna pick? So would you have to? It's like a would you rather. So would you rather preserve muscle? Can you guys hear me? Would you rather? Let me take this off too. Let me take this banner off. Okay. All right. Here we go. All right. Would you rather preserve muscle during your weight loss or would you rather build more muscle during your weight loss? So would you rather preserve what you have or build even more than you have? And I guess that would depend on where you're at in your journey. Let's see. While people are putting that in, this is for Anissa. I think it's Anissa. I don't want to mess up your name, Anissa. You're doing well. Studies suggest 0.5 to 2 pounds is normal in steady weight loss. Embrace your wins. Okay, did she say, I must have skipped where she said how much she's lost. I did ask that. And I think I scrolled down too fast. All right, very good. Very good. But if you saw her, what she said, that's great. Okay, what are you guys saying? This was we start off easy, right? And then we work our way up to more difficult type questions. All right. Posh Chambers, how are you? How are you? Hello. How are you? I love that name. Posh. It sounds like, is there a Posh Spice? Is that her name? Is it a Posh Spice? I can't even remember. But I love that. Okay, I'm trying to see if I'm missing something. Kim says, awesome, Christian. I'm on Mounjaro. It's doing wonders for me, but we're all putting in the work to do all the things necessary naturally. Also, kudos to all the type 2 diabetics that have lowered or managed their A1C. I agree. Great. Well said. Honey, okay, gotta stay quiet. Let's see. Okay, she said, no, Dee Dee, Mel B didn't give me Creatine. She 100% refused me. Okay. All right, Posh, welcome in. Okay, so what are you guys saying? Do you want to build? Debbie, how are you? Debbie, how are you? I just saw your little head down there. Come on in. Okay, so do we want to preserve the muscle we have? Right, so you're doing anything. You're just keeping what you have, or do you want to build more muscle? Okay, so what are people saying? Darian said 58 people, but 38 likes. Can you all hit the like button, please? Thank you. Hit that like button if you're out there watching. Okay, Mayor Mindy. Oh, my daughter says, and subscribe. It's almost time for her bed. Bedtime. Okay, so Mel says Bill, Harjarine Bill, Debbie Bill, Christian Bill. And Harjarine, I don't know if Harjarine wanted me to share this, but I mean, I looked at her DEXA scan. It is beautiful, beautiful, beautiful. She is building muscle. She is doing it. And I think most people who are starting off this journey with their DEXA scans, you know, you're looking for the bone density. Of course, you're looking for that muscle. The visceral fat is what most of us struggle with, right? Because that's one of the reasons why we're on a weight loss journey. But I mean, her scores were great. So one day she's going to come on here and we're hopefully, and we're going to talk about it. You know, just talk about that DEXA scan and, you know, give people hope who want to get one but are not so sure, you know, so you can see what the data really tells you. We kind of broke it down. All right. Thank you for sharing that with me, Harjarine. So Debbie says build. Christian says build more. Okay, very good. Build. We got to build. We got to build. We got to preserve. So Mindy, you must already be on it. Z says both. Okay, good. Build, build. And I think mine would be Harper, how are you? Hi, Harper, how are you? Okay, very good. Preserve. Harper says preserve. So we had 2 preserves. Okay, preserve for now. Okay, preserve what you have. Okay, Beverly says build even more. Okay, let's see. Uh, Kim says Mel wants to protect her kidneys. Okay, I love her for caring so much for me and my health. When you have chronic kidney disease, it's highly suggested. Reason being, it can make your creatine higher. Okay, I see. No, not creatine. I don't know how to pronounce that, but I know what you're talking about. That's connected to your kidneys and how your kidneys function. Very good. Oh man. Okay, very good, Mel. Mel is a sweetheart. Which is not good. It depends on how your blood work looks, if it's okay to take it. Since Mel is concerned, I have taken it. Mel B is my big sis, so I try to listen to the fam. Okay, you want to preserve a muscle. Okay, very good. Anissa. Anissa, 15 pounds in 7 weeks is in no way, shape, or form slow. That's great work. You're doing it. Okay, very good. 15 pounds in 7 weeks. That is good. Very good. You are doing it, and doing it, and doing it well. That Hell L Cool J song pops in my head. When you're morbidly obese like I was, if you maintain all of your muscle, you would have to be 100% muscle to hit that goal weight. Okay, all right, very good, very good. People are saying thank you. Harji, I'm so proud of you. Harjarine, congratulations. Yeah, she had a beautiful DEXA. She just, you know, her area of focus for us is just like everybody else, right? To get those pounds down, that visceral fat. Nicole, Mel is so sweet. I give her a hard time. You said you did take the thorn for a couple of months to boost your gains and muscles. Okay. All right. Very good. Harjarina saying thank you to everybody. Okay. All right. All right. All right. Here's the next question. Let's go to the next question. It says, all right. So for the future of fitness, what we see happening for the future of fitness, would you take, now let's say the pill was, it was pristine, right? Everything was everything. Would you take a pill to build your muscle, or would you just do the old school strength training? Or are you going to take a pill? The pill is going to do it for you, right? It's not going to have the side effects. It's going to, everything being equal. Would you do that, or would you do the old fashioned strength training? Old fashioned strength training. Okay, you're doing the old-fashioned way. Okay, thank you, little lady. Hey, Sandy. She says, hey, beautiful people. How are you? How are you? All right, all right. Shay, my name twin. How are you? Another Shay. My daughter can't believe it's another Shay. That is too funny. Okay, all right, all right. Ooh, look at these. Comparison is the thief of joy, says Deram. You will get your muscles when you get it for sure. Yes, yes, yes. I agree. Sandy with that beautiful profile pic. Very good. Okay, so Darian said the pill. Okay, all right. Wait, it's not showing. Okay. Shay says strength training. Christian says old school. Z old school. Bobby old school. Old school says Anissa. Strength training says Mindy. Old school. Old school. We got a lot of old school. Old school. Strength training. Old school. Lakeisha. I love lifting too much to give it up. She came in with that comment. Okay, very good, very good. If it's a choice, I'm a strength train. Hey, my name Twitch, Shay and Shay. Okay, all right. Does anybody know where to find reliable info for where your ideal muscle mass should be based on your height? Okay, all right. Who can help her out with that? Okay, all right. Mindy says strength training has other benefits like mental wellness. So this is what, if anybody can help her with this, does anyone know where to find reliable info to where your ideal muscle should be based on your height? So I'll have to look that up if nobody can get it to you tonight and get it to you. Slims in the making. All right, strength training has other benefits like mental wellness, right? We don't know if that pill's going to have that, Mindy. Though I'd add the pill if it was deemed safe via the trials. Okay, very good. Okay. Strength training the old-fashioned way. So it looks like we have a lot of old-fashioned ways. I do it the old-fashioned way. I don't need another chemical in my system. Strength training. I think I would do it the strength training too. I would do the strength training. I do enjoy it when I started, but it's just the idea of getting to it. Slims, I get a DEXA scan. That's the only way to really know. Is determined based on your individual body composition. Okay, good advice. I didn't think about just telling her to get the DEXA scan. They will tell you too what it should be. That's true. It's strength training for the win for me. And now away. Okay, very good. Slim, I second that. Slim is based on your age too, and I appreciate that. Your Slims appreciates that meal. All right, very good, very good. All right, so the next question, and then Slims, you could come on here and talk about your DEXA scan with us. We got a little group of us that are going to be talking about it. I'm trying to get rid of the meds, not to add more. I know, me too. Okay, what about this? If there's something you guys, I know the answer to this question, but if there's some breaking new GLP-1 medication that's top of the line, no side effects, it's all gravy, what are you guys going to do? Are you going to be the first to try it? Are you going to wait for the research to come out? Research. Are you going to be the first to try it? So in essence, would you be in a study? What if Eli Lilly came knocking on your door? Simply, Taisha, knock, knock, knock. I want you to try out some new medication. It's going to be, easy peasy, lemon squeezy. Are you going to try it or are you going to wait for the research? Wait for the research. I think I'm waiting for the research. What are you guys doing? Take that information. My daughter is so she's like, I wouldn't just take the information. Okay, what are you guys saying? I don't know if there's a calculator, but it's the opposite of body fat plus bone on your DEXA scan. Yes, 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 yes. So Harjarine is going to be the first to try it. So you would be in a clinical. Now, a lot of you, I remember saying you would be in a clinical trial. So what would you guys do? What would you do? So Harjarine says try it first. Slim said, hey, Taisha, enjoy your content too. Bobby says, wait for the research. Lakeisha says the research. Shay says research. Heavenly, heartily happy. Yes, welcome, heartily happy. Wait for the research. Okay. Hey, you're waiting and you're waiting. You're waiting. Okay. All right. You're waiting. Like you're waiting. You guys are so hilarious. You have been in a clinical trial, Mel B, for what? Tell us. Oh my goodness. You would wait on it. You gotta quiet down, honey. Wait on it. Okay, Christian says wait on it. Nope, no study, not signing up. Margie says, wait for the research. Slim says she's not going to be a guinea pig. Slim's in the making. I love saying that. Losing it, Grace. I don't want to be a guinea pig. You either. I'm awake, says Mindy. I'm good on trizepatide. I've only got about 20 to go. Okay, waiting for the research. Life is too good right about now. I love that. Right. What little Dee Dee said. You can hear her. She has 4 more minutes, so she can make this next question because she has to be in the bed. Wait. No guinea pig here, says Heartily Happy. I heard that. I'm actually happy where I am. So it's hard. It's a hard no for me this current time. Posh says research. Okay, yes, little Dee Dee is wise. She is on it. I'll wait for the research, Bev says, to come out. I'll let somebody else be the guinea pig. You guys are too funny. Wait for the research. Yeah, guinea pig is like, they would they experiment on animals a lot of times first before they do even go to the adults and the humans. I'm in maintenance though. Okay, yes. Let's see. I would have definitely agreed to it before. Now there's no reason for me to do it. Okay, all right. You said there's no reason to do it now. I used to want to do a trial because I would end up with placebo. That would be me. Plus, you get cut off cold turkey at the end of the trial. Even if you get the drug, then what? Then you just got to order yourself. That insurance has to kick in, I guess. I don't know. All right, very good. Posh is in maintenance as well. Very good, very good. I love that. Wait a minute, we have a super chat. Wait, says Mail to the B. Wait, all these folks saying less meds, but look at yous jumping in the I was in a trial for fibroid treatment. No singing, honey. I can't hear. You were in a trial for fibroid treatment. Okay, very good. Very good. So she's saying, all you guys saying less meds, but you're jumping on those trials. I think that is so funny. Okay, very good. Okay, what are you guys saying in the chat? Okay, let's see. Okay, Tia, we read what Healthy Spirit Podcast said. Darian said, I would sign up for research. I've investigated to sign up for some trials. Okay, all right, very good. All right, Darian, I hope you get in there. Right, Nicole, little Dee Dee knows her stuff. She's a smart cookie, says Miss Kim J. Yes, okay, free of charge. Sign me up because it's paying out of pocket. Is not cute. I didn't think about that. Yeah, if you're in the trial, you're not paying. But like Tia said, when it's time to go off, they're booting you right out of there. Okay, you would do a clinical trial. Okay, very good, very good. Uh, let's see. Delilah says, wait a minute. I see it like this. If I wasn't on Mounjaro already, I may have, but being in the trial would mean I could end up being on a placebo and have to stop Mounjaro. So it's not worth it to me at this time. Well, I say, I'm very good. I wish I was in maintenance too. I got a long way to go. I have giant fibroids. They are the size of grapefruits. Now that I'm thinner, I can feel them. Well, Mindy, are you getting them removed? Geez, Louise, I had this friend. I didn't have had this friend. I have a friend, and she had one. She told me they were as big as grapefruits. And I was like, she's exaggerating. She showed me those babies, and they were humongous. I can't even believe she walked around with that. It's just, geez, Louise. So, Mindy, oh my goodness. All right, so let me get to another question. Darian, you're so funny. I'm patiently waiting my maintenance in 2039. It's gonna be great. No. Okay, so here's the next question while my daughter is about to go to bed. Let's see. Okay, all right. So, this is a great question. Would you rather live longer or live stronger? Which one? Would you love to live longer or would you love to live stronger? I can't wait to see these in the chat. All right, which one? Love you. Good night. All right, what are you guys saying? Live stronger or live longer? You can't choose both. We want to choose both. If you had to choose one, is this or that? Did you hear it? I don't know if they heard you. Say it again. She's so fun. She said, "Good night, Divalicious fam." So cute. All right, so what are you guys saying? Okay. All right, this is interesting to me. Oh, so you were looking at the trial that a comparison of tirzepatide and retatrutide and no placebo. Ooh, no placebo. How about that? I love that. No placebo. Okay, all right. All right, Darium, not 2039. You said right behind you, Darium. Gray said at 2046. All right, okay, we're starting off with my name twin over here, Shay, even though I spell mine Shay. Okay, so live longer, live stronger. Okay. Okay, so Mindy says to have them removed, I would have to get a hysterectomy. I would have to be full surgery with a 2-month recovery, hard pass. Even after you're a triathlon, you don't think you would do it then, but it must not be that painful. So if it's not that painful or, causing any kind of disruption, I would, what do you have to lose? But yeah, that is a lot of sitting, laying up after that surgery. Geez, Louisa, you probably can't sit still that long. All right, Margie says, live stronger. Bellflowers, laughing at Dear healthcare is not for me. Stronger, stronger. We have a longer. All right, we have a stronger. Hopefully, Bobby chose one. We have live long, stronger, stronger. Health span, it is for me. Longer and stronger, strong, longer. We can reminisce of the great journey in fighting for access. Okay, so y'all are greedy, but Tia has the right idea. Okay, all right, stronger. Okay, Dee Dee, is this a trick question? No, and mine is going to be stronger. Okay, mine is going to be stronger. You know what, you guys, tomorrow, I'm telling you, tomorrow I have this video coming out. You guys have to watch it, watch it, watch it. And I am telling you, when you watch that video, we're going to have to come back here and discuss it. Maybe we'll discuss it a little bit on Friday nights live. Okay, tell her good night. So precious. Oh, good night. Thank you. Exactly, Tia. What did I miss what Tia said? Oh, strong equals long. Yes, yes, yes. So yeah, you want to have that health span going on. Love that. Love that. Love that. Let's see. After this, I'm going to release the video for my members because I have it plugged, just ready to go. And I'm going to release it for the members. So afterwards, if you want to watch it early, but I want to know what you guys really think about this video because I learned this interesting information. It kind of ties into what we're talking about tonight. And I just love learning new things. It's a lot of things, you kind of think you know a lot of stuff and then you learn something new and you're like, dang. At 52, how come I never knew this? So yeah, I'm excited about that. All right, let's see. What are you guys saying? Oh, thank you. Thank you guys for saying good night. She loves this community. Oh, thank you, Debbie. Thank you. Journey of life. You said I'm not strong. What did you say? If I'm not strong when I'm old, I don't want it. Because ain't no way my kids are gonna change my diaper. They can barely clean their room. That is a word. Yes, yes, yes. I just saw somebody say that. Good night, little Dee Dee. Oh, you guys are so sweet. I can't wait to watch it. Yes, it's tomorrow. Tomorrow. Yeah, you're going to love that video, I think. And you might have already know the stuff I'm just learning, Christian. We'll see. Stronger. Sweet dreams, baby Dee Dee. Okay, okay. So let me ask you guys. So tomorrow when I release my video, I usually release it around 3 o'clock-ish. I was thinking of, should I do it earlier? But I am going to release it tonight for the people that have the membership. It's like little tiers to it. So for some members, they'll get it tonight released. But what's a good time? Like, what time are you guys watching videos? Are you up? Now, I know a lot of us watch videos when we first get up in the morning. Are you watching around 9? Are you watching at your lunchtime? Are you watching at 3 o'clock? I don't know. All right, you guys say stronger, stronger. So stronger was it? Mine is stronger too, and I agree with Tia. Stronger is longer, right? So when you're stronger, you can actually live longer. So that's why I would have chosen that one. And there's so many reasons why, but I'm going to talk about that in my video tomorrow. All right, so here's another one. How about this? Would you rather have a strong mindset or strong muscles? I can't wait to hear what you say for this one. Would you rather? You can only choose one, Bobby. Strong mindset or strong muscles? Which one would you rather have? All right, Christian is saying lunch or after work. Okay, okay. So I think I have a pretty good time now then. Would you rather have a strong mindset or strong muscles? What are you guys saying? Beverly, this is not a trick question either. All right, all right. I'm all excited about these answers. It's too funny. All right, Simply Banks. Hey, Simply Banks, how are you? All right, all right. Let's see. Okay, all right. What are people saying? Oh, thank you for the good night, baby Dee. Okay, I saw you, Christian, in there. So I think if I keep my time, it's good. Mindset. Okay, mine. Strong mindset. Okay, mindset. 8 p.m. Okay. Okay, thank you. Mindset, strong mindset. Okay, very good. Me too. I would rather have the strong mindset because then I can build those habits, put those systems in place to, keep up the good work that I'm trying to do, right? Very good. I love that. All right. So what about, this is a question for you, and please do not get offended out here, but it is what it is. Okay. Would you rather be obese or would you rather be skinny fat? And you can only choose one. Would you rather be obese or would you rather be skinny fat? And not, obese has levels. It's obese 1, 2, 3 at that first obese stage, not the third one, right? Because the third one is if your BMI, I want to say your BMI is over 50 something or another. So what would you rather be? Skinny fat or obese, the early stage of obesity? And I see, a lot of people are saying, mindset. Yeah, we got a lot of mindsets. I love that. Very good. Great answers. Great answers. Of course, mine is mindset as well. We got mindset down the road. Can't be picking up the weights, but not knowing what you're going to do with them. Mayor Mindy, yes. Okay, mindset. Very good. So you got to pick one, male to the B. She says, I really don't know. Would you rather be obese, the first stage of obesity, not like level 3 where you're super, you're in that top category, there is nowhere else to go. Like, so you go from overweight to that first category of obese. Would you rather be that or would you rather be skinny fat? Which one is it? We have a new member, Christian. Yes. Welcome. Oh, that's so sweet. Let's give her some confetti. Yes. Where's the confetti? Yay. All right. Okay. What are you guys saying? Thank you, Christian. Welcome. Okay. So what are we saying here? All right. Margie. Margie, oh my gosh, you are funny. Oh my goodness. Okay, we got some coming in. Okay, so Darian says obese. Male, you gotta pick early or obese. Early obese. That's too funny. Obese if it's one, I'll take that. Over skinny fat, huh? I can change skinny fat. Obesity would be more difficult for you to tackle. Okay, early obese. This is interesting. The last question I would have to research before I could answer it. Okay. I was just there. It wasn't that bad to be obese. Okay. All right. Kind of one in the same. Okay, what do you mean by that, Bellflower? I guess obese. That cracked me up. You said, I guess. If I got to choose one. Oh, yes. Thank you, Darian. It's Darian. Welcome. Christian. That's so cool. All right, Bobby, obese one is where I was when I started. Okay. All right. Very good. Bev, research. Oh, Debbie says skinny fat. Now, this is coming from a lady. How many pounds have you lost, Debbie? So you would rather be skinny fat. Do you mind telling us why? Skinny fat. I just want to be skinny. You just want to have skinny in that name. I love that. I used to be obese 3. Okay, now you know what? I'm gonna have to talk about this too. I think I was in the obese second category, right? Because it's 3. 1, 2, 3. I was just doing some research about this. Yeah, she likes to hear. Welcome. Oh, thank you. I'm already obese 1. Okay, all right. Journey. Me too. I think I might still be obese too. I have to look that up real quick. Skinny fat joints wouldn't hurt. Wow, that is the way to look at it. I didn't think about that. Christian is saying, thanks to everyone. Now, that's a good point. Too much body fat with both options. Obese, I feel like I'm skinny fat now. You were obese too. Okay, so you come down. Jeez Louise. Okay, just an FYI, a few messages were deleted for no good reason. Okay. Oh, so you didn't do that. YouTube did that. Okay. All right. Thank you, Mel, for that. Okay. What about this? Would you rather have, and I'm just wanting to see what you guys are thinking. Okay. Would you rather have diabetes or high blood pressure? And I know you don't want either one, but if you had to pick pick one, which one would you pick? And I'm going to put mine in the chat. If you had to have one, you had to have one. You can't say neither. We don't want either one. But I mean, if you just had to, which one would you pick? This is mine. Interesting. 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 I see him rolling in here. Okay. Margie. She says, that's tough. It is tough. It is. You don't want either one, but if you just had to deal with one of them. Kim, I'm interested in what you Tia. Oh my goodness. Tia, that is too funny. Oh my gosh, you guys have such a great sense of humor. I will say that. A great sense of humor. Okay, so let's see what the folks are saying. Okay. So Mel says high blood pressure. We got a high blood pressure. Bobby says quicker to treat. Okay, very good. You lost 224 pounds. Jeez Louise. So you said you'll take skinny fat any day. Oh, Debbie, we got to give you some confetti. Jeez Louise, let's give her some more confetti. I love that. Okay, all right. One more time. 224 pounds. I mean, geez Louise, I gotta straighten myself out behind that. Oh my gosh, Debbie. Okay, I see why you said skinny fat. I could see that. Okay. All right, what are we saying over here? Let's see. I said, so she says, wait, I scrolled down way too much. Okay. Okay, so Mel says high blood pressure is more easily treatable. High blood pressure. Okay. So Kim says she felt she was happily obese. Though I thought it wouldn't hurt to lose. It was mostly the A1C that put you on the journey to lose. Okay, all right, very good, Kim. So you're saying, okay, I see that. Beverly says she feels like she could control the high blood pressure easier. Okay. Okay, very good. So we have another high blood pressure between what options? Diabetes would save me $550 a month. Oh my gosh, geez, Louise, that tickled me. But you know what? That diabetes is nothing to play around with. We don't want to get that. But yeah, it does. You know, a lot of these meds are covered under that because of how how much of a disease it is, a terrible disease. High blood pressure for sure. The diabetes play too much with our lives. Yes, true. The meds are cheaper for high blood pressure. True. Neither, Dee Dee. Okay, you just can't choose. Okay. Tia, she's with Tia on that cheaper. We're gonna have to talk about these questions. Okay, if you had to choose. Okay, sorry about oh no, that's okay. The YouTube is automatically, I think, doing that. I'll say behind the next time. Okay. High blood pressure. Okay. All right, very good. All right, okay. What about this? Would you have now? A lot of you probably already have done both, and so you'll just have to let us know. But would you rather have the gastric bypass surgery, any kind of weight loss surgery, and it comes with free skin removal, okay? Or would you rather take a GLP-1? Which one is it? Now remember, the gastric bypass, the bariatric surgery, comes with free skin removal, body contouring, and all of that, right? Because you're having the surgery. Or would you just take that GLP-1 and love that loose skin you're in? Oh, geez, Louise, I gotta take a drink of my water on that one. So you say, Margie says, been pre-diabetic for years. Now you're a full diabetic. Okay, so hopefully we can get you back out of that diabetic range altogether. That's coming, that's coming. And that's how I was too. I was a pre-diabetic, and then I never thought I was going to become a diabetic. I said, what in the world? Are they trying to trick me? And yeah, it happened. So I was thinking that'll never happen to me. So I'm back in the pre-diabetic. I'm trying to get to that normal range. All right. So Simply Taisha says GLP-1, Bobby, GLP-1, meds for show. Have a great night, Delilah. GLP-1, GLP. Dee Dee, I can't with you. GLP, I'll figure out the skin later. Okay. Surgery and all the things. Okay. All right. Very good. Okay. Had physical therapy today with the same therapist I had 3 years ago when I had my knees done. None of them even recognized me. When they realized it was you, they were in shock. Oh, that is a great non-scale victory, isn't that? Jeez, Louise. All right, there you go. Look at that. And I'm sure 220 something pounds, 24 pounds down. Oh my gosh. Jeez, Louise. I didn't even do that. My hand is just trained for that 200 pounds down. Oh, jeez, Louise. All right, GLP-1, GLP-1. Darium says with the surgery, get your body sculpted like Atlas or Hercules and Adonis. You are too much, too much. Okay, all right. You said the GLP-1, no loose skin, and you're not loose skin, you're in. Canadian Queen, how are you? How are you? She says, hello, Didi Mods in chat. I'm late and we'll start from the beginning once you're finished. Oh, that's so sweet. Thank you. We had a good time talking about muscle here. Who knew you had so much fun talking about some muscles? GLP-1, I wouldn't qualify for the surgery. Okay. Okay, all right, very good. Debbie, that is incredible. I mean, 200 and something pounds. Jeez, Louise. Okay, so this is the last question. This is a protein question. I thought we'd go out with protein, and then we're going to talk about the drinks, the supplements. We're going to talk about the drink that Mel shared and that I tried to, I'm going to duplicate. We're going to talk about Linda's journey, and then we're out of here. So last question, and Simply Taisha, we're going to put this question in here for you so you can actually answer with it. So would you rather have as your protein of choice, you had to pick one protein of choice. Would you pick chicken, steak? You had to eat this for let's say you had to eat this protein for, 6 months. What is your protein of choice? You only can pick one. Chicken, steak, or chickpeas? What are you choosing? Chicken, steak, or chickpeas? All right, Slims in the Making says, I'm learning healthy habits. I had the surgery, lost the weight fast, got pregnant with twins, and got fat again. Oh my goodness. I bet you those twins are adorable though. Oh my goodness. That's okay because we're taking it back off because you are Slims in the Making. Slims in the Making. For at least 6 months. Taisha, I could have answered for you. Okay, what do you got? And what am I having? You know what? You guys know I don't eat steak, so I would have to do the chicken. But I could have chose chickpeas, but I don't even know what's up with the chickpeas. That's not even something I really ate when I was doing the pescatarian diet. So I'm curious to see steak versus the and chickpeas. Okay, chickpeas. Don't count those chickpeas out. So we got a chicken, we got a steak. Let's see. I'm gonna keep a tally because I just am curious. So we got a chicken, we got a steak, we got another chicken, we got a chicken. Ooh, chicken's up. Kim said, so I would rather not have any more surgeries if I don't have to, but the option of being free 99 is putting her on the fence. What's one more surgery? I mean, if it's successful, of course. That tickled me. Okay, free 99. I know that's right. I love me some free 99. Okay, Canadian Queen is going with that chicken. Okay, we got another chicken. So far, I'm counting that's 5. Okay, chickpeas. Taisha, my girl Taisha is in there with the chickpeas. Okay, we got a chicken. We got another chickpeas for Taisha. Okay, all right. We got a chicken. We got a steak. Okay, another steak, another chicken, steak. Okay, you're gonna have to go with grass-fed steak meal. Oh, give me the beef. Okay, we got another steak. The steak is coming, trying to catch up with the chicken. We got another chicken. So we got 10 chickens so far. It's Darium coming in with that steak. Okay, Downsizing Diva coming in with that chicken. I feel like I'm at an auction now. All right, you love a good ribeye. Yes. Okay, Posh says a steak. Ooh, okay. Journey, steak. Pat J. Hello, Pat J. Look at that. Is that a peacock? What is that? It's beautiful. Oh my goodness. Okay, coming in with that steak. Okay, all right. Steak is catching up with the chicken. What is going on here? Yes, the male to the B. Dee Dee, you in these questions. Simply Banks, how are you? Look at that beautiful profile. Yes. If there's a method to my madness, you probably won't know about it for a couple months because I don't dish out videos that quick. Thank you guys so much. Weight really changes the appearance. I love people not recognizing me. I know that is so cool. I mean, geez, you lost a whole 2 people almost. You could have lost 2 people. All right, I thought salmon would be on the list because that's my real answer. Yes, I didn't put salmon. I made one to make it more difficult. Simply Taisha, have you ever tried air fried chickpeas for a crunchy snack? That sounds good. Okay, chicken. All right. Oh, another chicken. Wait a minute. Okay. Uh, hit my first goal today, down 15 pounds in 9 weeks. I'm so happy. Found you all, and it's working. Ozempic didn't do anything for me. Thank you all. Well, we love it. Go Canadian Queen, go Canadian Queen, go Canadian Queen. We love that. And you know what? I didn't know that was going to stop on its own. I've been just turning it off. Okay, so that's good to know. I'm just learning too. Okay. Queen, congratulations. Love it. Congratulations. Okay. I feel like I'm going to have nightmares with these no real right answer questions. I feel oh my goodness. No, Mindy, everything is not a right or wrong. She said every single day. I don't know what that means every single day. Oh, the chicken, another chicken, another chicken. I'm off my 1, 2, 3, 4, 5. So chicken Okay, what are you guys saying? Canadian Queen, awesomeness. Is steak causing people constipation? That's a question. Not taking magnesium, of course. Okay, so not taking magnesium causes it. Okay, so that goes right into some little supplements I'm gonna tell you guys. Um, if you're let's go to this. You guys are awesome. Okay, really quick. Let me just tell you. Chicken had 13, if I'm correct. Steak had 8, and chickpeas had 2. I only saw Felicia, Marie B, and Simply Taisha. And if I miss somebody on the chickpeas, let me know. All right, so let's go to Miss Linda. Now on Friday, if you're coming on Friday at 8:30, we're gonna be talking about dating. We're gonna be talking about losing weight, dating younger, dating older, what that looks like. So if you're married, we're going to talk about your husband, before you were married. Maybe you can share with us. And is your husband older than you, younger than you? Do you go for the older man or not? We want to know. So I'm going to put this on my community tab, but this is Miss Linda. She's not in here tonight. But if you go to her page, Linda's Journey, she has probably most of her videos are now where she's making drinks. I don't know if you can see that. I couldn't get it too big. But anyway, she has a bunch of drinks. So if you want to make one of those drinks and bring it on Friday, bring a drink. I'm going to try to make one of her drinks. I'm going to try to make one of her drinks. And if I don't, I have an Alani that I'm going to either that or have the Alani. The only thing about that Alani drink that I may have is it has caffeine and it's at night. Like that live is at 8:30. So I don't want it to have me up all night. But I think that's what I'm going to do. I'm either going to make one of her drinks or and I'm gonna put a couple of her videos on my community tab. So if you're looking for a drink, go to Linda's Journey's page. It's called Linda's Journey. And she has all different kind of drinks, all different kind of concoctions that you can make up. If you can see, I don't know if you can see as big as me. She has a protein drink. She's on Zepbound. I think Linda has lost not 100 pounds quite yet, but close to it, if I'm not mistaken. So she's doing great on her little weight loss journey. So go to my community tab if you're looking for a drink to bring on Friday. And then this is the drink that Mel told us about during our last live. I think it was last Wednesday. And if you look over here, I don't know if you can see my arrow, but this is Mel. She says LaCroix. That drink we got it from Whole Foods. And she puts that sparkling water. It's the plain one. She adds her apple cider vinegar. She adds 1 tablespoon. And she uses, I don't know, she said she didn't use that big cup, but you can, because, you can obviously see if you fill it up, it's not going to fill up that whole cup. This was me trying to be cute. Here I am with my LaCroix, my apple cider vinegar. And initially I had gotten a glass you would drink wine off of or some fancy drink, mocktail out of. And then I said, oh, Mel had a big old Stanley cup or some kind of Yeti. I think that's a Yeti. I don't know. But anyway, so then I did that, but I didn't make mine yet. So if you want to try that, she says, sip on that. This sparkling water is the plain kind. Add your apple cider vinegar. So if anybody was interested in that, that is what that drink is about. So if you're interested. And then the final thing I want to share, you said it is a Yeti. Okay, because I have a Yeti too. I was like, it looks familiar. Okay, so last thing I want to share, this is Amazon stock up. Now, these are the staples I use for my vitamins. I use a Garden of Life, all things Garden of Life, but I have some other brands in here too. So I'm just going to show you real quick in live and living color what I use. So this is my number one staple. I don't know if you guys can see that Garden of Life. That's a multivitamin. They're a little bit more expensive, but honestly, with supplements, and I'm not a doctor, so talk to your doctor before you try any supplement. But honestly, this is one of the best. It's a little bit more expensive. It's not like the Nature's Bounty, but it's very good. It works. And actually, I have 2 bottles of that. That's the multivitamin. And I think you have to take 4 capsules. You have to take 4. And so this is the smaller one. And of course, this is the bigger one. And then I also take, for those people who want something for fiber, I do take the Mago 7. So I don't know if you can see that. Here's the psyllium husk caps. but I do take Mago 7 as well. So here we go. Look how the color has changed because I'm blocking that light. It's so funny. Okay, so either one of these. And then I also take, this is a staple. I take Garden of Life COQ10. And this helps with, of course, it has chia seed oil in it, raw chia seed oil, omega 369. This really just helps. It's like, it's heart health. Like I take it for my heart health. It's a staple. I always take these. And yes, I am not a doctor. These are just supplements. Thank you, Darian. Let me put that up there, my disclaimer. And then this is interesting because I was telling Mel to the B. So sometimes I go to a holistic doctor. And I say sometimes because it's $300 a pop just for the office visit, like just to see the doctor, not anything else included. And my insurance does not cover it because it's holistic medicine. So when I first went to her, she was telling me about these supplements I could take. And she said, doctors try to get you to buy the supplements. She was selling this brand. It's called pure encapsulation. Did I say that right? That's it. So anyway, she had told me about these supplements and she said, I'm going to be honest with you, you could get them on Amazon cheaper than you can if you bought them from me. So she said, if you bought them from me, it's more expensive. So she told me to go on Amazon and buy them, and I did. So I've been using these for years now. Love these. Any supplement you could think of. I get my magnesium. This is the brand. If I weren't using this brand, I would be using the Garden of Life. It's everything is plant-based but my diet. Taisha, I told you I used to was dabbled in being a vegan here and there. And then, of course, here's the Garden of Life 2 vitamin D3. If you get that D3, when you get vitamin D, we're all probably, now my vitamin D levels are great, and that's because I take a supplement. If you're not in the sunny state of Florida or Texas or any kind of state where the sun is shining more than it's not, it's going to be hard to get that vitamin D in unless you're just going outside, standing in the sun. And most people aren't doing that. So I would invest in a nice vitamin D supplement. So I take that. And then I told you for the hair, my hair started thinning out. Before even I started Mounjaro, it was thinning out. I take this Nutrafol for women. And this Nutrafol is one of the more expensive things you can buy. And I do have a cheaper option. But here it is. This is one of the top researched hair vitamins. The problem with this is it's expensive and you need 4 capsules to even it takes 4 capsules. And you can see it takes 4 capsules on there. So of course I have that for the hair. So you can just imagine how my pill dispenser looks. For supplements though, this is another option for the I showed this, but this is another option for you for the omega 3s. Now I showed this one, but you want in your omega 3s to have the EPA and the DHA. You want both of those. So I also take this. I got this from the vitamin store. I do have a link where you could get it on Amazon if you want it. You could get that and try that. If you're eating fish like me, like at least twice a week. Remember, I was pescatarian, so that's all I was eating at one point. Then you would get this one because this one has more of the omega 3s and what you need. If you are eating fish twice a week, this would suffice, right? Because this one doesn't have, has 1,000, whereas the other one has 1,280. So there you go with that. And then another thing, somebody asked me about B12. I told you, whatever you need, I got it. So I do take B12. Here is what I take. It's a spray, and it's, of course, Garden of Life. Garden of Life is my supplement of choice. It's more expensive, but it's heavy duty. It's quality. I also take curcumin. I don't know if anybody else takes that. But this is good for, it supports your joint tissue, your liver, your colon, and your cells, all the cells in your body. So I do take that. Then when we had that virus going around that nobody wanted, they were telling you to take zinc. So I haven't really been taking this, but I have zinc capsules that I could take. This I haven't been on my regimen. If you want something, a cheaper option for your hair, skin, and nails, this was researched, and actually this does a great job. I think this has worked. This is what I've been taking to help with my thinning of my hair. I don't have this linked at all, but if you just were curious, to me, it doesn't work. So that's why I didn't link it. I don't think it works. And it could be working, and I just don't know. But we have fiber, well, gummies. And so you can, get some of those. Do I have these linked? I don't think I have them linked. Like I said, they haven't worked for me. These are not linked, but I use this if you have kids. For my daughter, Smarty Pants, a good brand. So my daughter. And then these two, I don't know if Taisha would, I don't know if you're into the protein of it all, but here is the protein powder that I use when I make my own smoothies. I do have that linked in the description if you're interested. It's the organic protein, and it has 21 grams of plant protein, and it has, I want to say this has, it says it has 9 grams of fiber. Does that say 9 grams of fiber or 3 grams of fiber? Wait. 3 grams of fiber. Okay, 3 grams of fiber. Okay, very good. And then this is something else that I have. These two I have been known to take, and I don't take them. I haven't been taking them here recently, but black seed oil. I don't know if you guys are hip to that. And then I also take ashwagandha. And of course, you see Garden of Life is, most of my meds are going to be from Garden of Life. I mean, not my meds, my supplements. And then black seed oil. If you guys hear a lot about natural healing, black seed oil is what's up. And I do take these faithfully as well. So the taste of Orgain, it has cane sugar in it, a little bit of cane sugar. Empower Wellness by Teddy. I have to give you the Downsizing Diva welcome. So it tastes pretty good because it has like a little bit of that cane sugar in it to give it that little sweet taste. So those are the supplements I'm taking. I just also, I'm going to link that maybe. I think, did I link it in the description? I don't know. But I had shared with Mel like this pill container because can you imagine all of these trying to fit in a pill container? You have to have a really good one. So we just bought, Mel got hers today. I didn't order mine yet, but my dispenser, to be bigger to get all these pills in. So, but my staples, I just saw somebody say, you take all that stuff. Okay, so sometimes when I'm feeling overwhelmed or in a hurry, I'll take these to work and take them there. But this is my staple. Really, what you need is, I'm just going to be honest with you. What you honestly need, if you have a good diet, is a vitamin D. And in order to make that vitamin D most efficient, you're going to have magnesium and potassium. If you just take those 3 things, you don't need anything else. If you just had to pick 3 things. But I would say I would take a multivitamin. That's why we take a multivitamin. I would take a multivitamin with that vitamin D3, whatever your magnesium is, take that, and then potassium. If you eat some bananas, but you could take a potassium supplement. But if you take a multivitamin, it's going to have your potassium covered. So really, you could just boil it down to 3 or 4 things that you're going to need to help you. But anybody who's not taking a supplement and your vitamin D3 is in the normal range, you should give yourself a pat on the back because most doctors don't have vitamin D levels where they need to be. So yeah, that's a lot of stuff. That is a lot of stuff. I know it's a lot of stuff to be taking. But when I hear about a supplement, I want to take it and try it out. But when I really just want to do the basics, I'm down to those three, right? I might say I don't feel like taking it for like a month now. I'm just gonna take that vitamin D3 no matter what. I'm gonna take that magnesium no matter what. I'm gonna take those not multi, but the multivitamin no matter what. And then another thing I never forget to take is this is expensive, but it's worth it. So you don't have to get this brand, but COQ10. Ask your doctor about that. So I would ask your doctor about all those supplements. So that's what I take. So yeah, I would take that, like I said again, where's that Darium Downsizing Diva is not a doctor, pharmacist, a shaman, witch doctor, nor a dietitian. Consult your healthcare team before starting any supplement. So I think, Christian, I saw, how often do you take the Mago 7? Well, I don't take it every day because I don't really need to. This is an open bottle. My open bottle I have in my little cabinet up there. But I take it probably out of the week. I haven't needed to take it. So if I don't go to I'm not somebody who just takes it every day. So if I haven't gone to the bathroom after 2 solid days, then I will take it. So I haven't needed to take it anytime this week, actually. I've been going. The week just kind of started. Let me see. Last week, I didn't take it either. I didn't need to take it last week. So yeah, it's just a hit or a miss. So if I go like that, so today's Wednesday. If I go, I went today. So if I don't go tomorrow and then Friday comes and I don't go by like the evening time, I'll take it if that's helpful. So I don't just take it every day. Like I know some people take it every day. I guess if I took it every day, I probably would go every day. I don't know. This is, I probably should take these every day, but I don't either. And these have, let's see, this has not that much fiber. How much does it say? I think it says 1 gram, all the different fibers. So I think it adds up to like 4. What does it say on the front? I think it adds up to like 4. And how many tablets do you have to take of these? You got to take 3. See, that's why I'm not a fan of this, because you got to take so many pills to get the maximum benefit from it. Okay, so what do you guys what are you guys saying after my little regimen there of everything we're taking? Uh, okay, so we got that. Okay. D3 and K2 should be taken together. Okay, vitamin K2. So if you have it in your multivitamin, is that enough? Because I've never heard that take the K2 with it. But in my multivitamin, I should be covered. Fun fact, darker skinned people absorb less vitamin D. Yes, I knew that because of the melanin. So it could be beneficial even if they get sun. So they could be deficient even if they get sun. Yes, yes, yes. A lot of times we are even more deficient because we're not going in that sun, because it soaks in your skin. You get hotter, quicker, faster, right? You're absorbing that sun. So yeah, a lot of times Black people and people with darker skin are more deficient than any other group. Thank you, Mindy, for that. Mayor Mindy coming in with the fact. I swear the supplements are trying to outprice the Trizepatide. Yes, it all adds up. The good thing about it is a lot of them are 60 to 90 day supplies of it. So that's helpful. So you take the turmeric. Okay, very good. Curcumin too. Okay. Yes, Canadian, the vitamin K helps you absorb that vitamin D3. Yes, yes, yes. And so that's why I say I also take that multivitamin, and then I take this D on top of that. So I'm covered in that way. Hey Grace, she's saying, how's the taste? I think I answered that. Do you take them regularly? All regularly? Yes, I do. I do. And if I forget, or if I get like overwhelmed with taking them, then I just take the staple. So that's still that's my daughter, so don't include that. But 1, 2, 3, 4, 5. And really these two are the same. So that puts me down to 3, right? My magnesium should have been in there. I put these two. My magnesium should have been in there. That's my regular too. So yeah. So in a crunch, remember I'm taking the multivitamin. I'm taking the the C the COQ10 in a crunch, right? When I just don't want to take a whole bunch of stuff. This is my non-negotiable. I'm taking the vitamin D, right? This is my crunch, Kim. And then I'm taking, oh, you guys can't see. So this is what I'm taking if I just didn't have a choice. And my magnesium, where is that at? Where did it go? Oh, here it is. So yeah. So if I'm in the crunch, that's what I'm taking. Just those four. Okay. All right. So what are you guys saying? And you know, the reason why we have to supplement now, if you have your diet is so on point, you don't have to supplement. That's great. My diet is not that on point. I need to supplement just in case. But yeah, I would definitely check with your doctor. I'm one of those people when people say like things are working, I'll try it out. And you know, a lot of times I might not like it or whatever the case may be. What are you guys saying? Journey, taking the midnight train, going to Motherville. I bought the Lean Fit vanilla protein and it's delicious. Okay, Lean Fit vanilla protein. Lord have mercy. Do you ingest anything other than Yes, and you know what? I'm going to be honest. I should have brought this up. I stopped taking these supplements, the pills at one time. I started back because I started taking grooms. I don't know if you guys know what that is, but it's like a multivitamin. It's a gummy. And I was like, oh, and it tastes good. You know, I should have brought those up. Maybe I'll bring those on Sunday when I go live on Sunday or Friday if I remember. But I take a grooms multivitamin. I was taking that. It's just a little packet of you know, vitamins, and it's supposed to be veggies, like you get your fruits and veggies in with it too. And so, to me, I don't think it had the same impact as the supplements I was taking. So, I didn't continue, but I do have a link to that if anybody is interested in trying those out. And you might say, "Oh, it didn't work for you, Downsizing Diva," but all of our bodies are different, so it might not work for me. But remember, I'm type 2. I'm still in the pre-diabetic range. Like I have things going on that maybe it didn't work for me, but it may work for you. So if you're interested in ordering that, I'll put that is linked in the description as well. She said that's a big cocktail of meds. I know. Which pill case did I get? Let me show you how it looks. This is what Mel sent me, but I think I put a link to that in my description. I think I'm gonna put that on my community tab because if you're taking, let's say you're taking 5 or 6 and some of your pills are bigger, you're gonna need like an extra large pill dispenser. I should have brought mine up, the one I'm currently using, and it doesn't hold everything, which I'm sure after you saw what I've taken, you're not surprised. Let me show you the picture, but it is a link in the description. Let me see. Where is this description? Who sent me? Okay, mail. Shoot, I forgot. Let me see. Okay, here it is. This is what it looks like. It's Darium. So I'm gonna be ordering this baby tonight. And you can see, and it's a big size. Like all my pills will probably fit in there. And what's cool about it, and Mel, because I sent this to Mel, you can take it out and take that little. Now I won't be taking mine out, but you could take it out, and if you take it out, you could carry it with you. Like let's say you're going, you know, you want to stick it in your purse and take it to work with you. But I won't do that. I'll just take mine at home. This is another tip too. I was explaining this to Mel with my meds too. Something else I do with not the meds, but the supplements is I take some supplements in the morning and I take some at night. Now, magnesium, they say you should take that at night because it helps you sleep. And so the one that I take that at night. And so I take my vitamin D at night too, because I'm kind of trying to take that together. So some of them, I've tried them different ways. I don't notice the difference to be honest. But I split them up. So I'm not taking like 15 pills at one time. So I do take some in the morning and some at night. I will do that to kind of split them up. But it just depends on what you're doing. I don't know that it makes a difference or not. Let's see. Uh, uh, So you said you take DK and K3 magnesium at bedtime, B12 and cod liver. Oh, I heard that cod liver oil is good. Now this spray, this is some good tasting B12 spray. It has a great taste to it. Cod liver oil, interesting. Okay, Dee Dee, I'll be using some of those links. Please do, please do. Mel, I want a new pill case. I'm gonna check it out. Yes, yes, yes. So let me make sure I put that pill case because I'm pretty sure I did. I put it in the description of this video. But yeah, I sent it to Mel earlier, or actually, yeah, so she could order it through my link, which was nice of her to want to even do that. I'm checking now to see if it's in there, the pill container. Yes, it is. So I have my links I have them organized by supplement. So it's at the very end of my supplement list. Hair products, exercise equipment, skincare, and food and protein. So yeah, go in there and get that link. All right, very good. Thank you. Thank you. Thank you. Most multivitamins only have vitamin K1. Double check tonight. If any multi has it, it'll be vitamin code Garden of Life. Yes, yes, yes. So let me look. I might need my glasses. I should have my daughter look at this. This is so vitamin K. I'll look at that tonight. Yes, this one has vitamin K1, 130%. And let's see, what kind of, we said vitamin K. She said K3. Okay, this also has vitamin K. I think that's 3. It also has vitamin K3, or is it 2? I can't tell if that's a 2 or a 3. Sorry. Yes, yes, it says B12. Yeah, it has a ton of stuff. B1, B2, B12, B6. So yeah, this is what's up. I'm telling you, this Garden of Life, go for it. All right, so what are you guys saying? Let's see. Canadian Queen, you are so right. I take D3 with K12. The K12 allows it to absorb better. And you know what? The some of the guru doctors say potassium helps it absorb just as good, if not better, than the K2. So I don't know. Sorry, TMI. I've been constipated on the 2.5. So hopefully, yes, try that Mago 7. I'm telling you, that works. Within 12 hours of you taking that, you're going to be going to the restroom. Do you currently have, or have you ever felt nausea from any of your supplements? Absolutely not. Nope. I have not. I would have stopped taking them. I don't like to be sick. Like, that's a feeling I do not like. I take collagen, CoQ10, magnesium, 10 in 1 complex, digestive enzymes daily, Body Tech liquid electrolytes and water, apple cider vinegar shot sometimes, turmeric powder and foods, liquid cod liver, oil sporadically. Okay, very good, very good. You take a lot of stuff. ACV with water or water and lemon. Okay, very good. Dee Dee, please send me that link to the pill case. Okay, yes, I sure will. I sure will. Okay, I will send you that link. Yeah, I was looking. I told Mel I gotta find a big container for all this stuff, and I just came across that one, and it looked good. And Mel ordered it. She might have ordered hers yesterday. I was waiting to talk to my dad. I still haven't talked to my dad, Mel. Because before I ordered something, I think I'm going to place my order tonight because I don't want things to sell out. So yeah, if you go to the description, the link, and some of these things like that I'm hearing you guys say, I'm going to put on my community tab, a post tomorrow. So yeah, Delilah sent me this case. Okay, very good. All right, well, do you guys have anything else you're celebrating? Do you have any wins or any struggles you need help with? Because if not, We are out of here, and I will see you guys on Friday. On Friday for date night, Friday night. Come with your drink, your cocktail. I'm gonna come with a mocktail. I'm gonna put on my community post one of Linda's Journeys drinks, and so people could go to her page and bring a drink that she makes. You want to help her out with her channel and supporting her channel. She's over there making those drinks. Those drinks look so good. I'm like, gosh, I wish I could fly her here and fly her back. So I will see you guys. Let's see. Canadian Queen says Dr. Berg is on YouTube. A wealth of information about vitamins. He sells vitamins too. I don't know about that. I don't know. I always just think, like, is he really a doctor? Not bashing him, because I do like Dr. Berg, but I don't know. I've seen people saying you know, that he's well, I'm not gonna say on here. I have to tell you in the chat. Maybe I'll put it in the chat, because then everybody out YouTube land can't see it. I don't know how true this is, and there's nothing wrong if he is, but people say that he's heavy, that he's one of these doctors from this. I don't know if I'm spelling it right. Did I spell that right? So yeah, so people say he's, with that, like Tom Cruise. I love me some Tom Cruise, but people say that there is kind of iffy. I don't know. So I don't know. But anyway, yeah, I do love his channel. So yeah, yeah, That's all I'm gonna say, because that's a powerful community. They might have me booted off YouTube. All right. Thank you guys. Christian, thank you again. All the people that are newbies to the chat, we enjoyed having you here. I enjoy everybody. If you are a content creator, you want to drop your mic in the chat so people can know to check out your channel. I didn't do that. We had so many newbies here. So if you want to do that, but we're out of here. I will see you guys on Friday. We'll also do that on Friday. If you come on Friday to drop your mic, people might have gone off the chat. Some of these content creators might be asleep by now. Thank you so much. Thank you for joining the membership. Thank you for supporting. I'm going to have to explain how this little membership works, because I got to get that going with my people that are supposed to have member-only lives. We got to get some of these member-only lives going. Thank you guys. Debbie's Weight Loss Revolution, Kim J Sweet Healthy Life. They're all content creators. Go check them out. Anybody else was in here? I can't remember, but I gotta go, because I gotta go to the restroom. I'm so sorry. All right. Thank you. Have a good night. Thank you for stopping in. We've been in here for 2 hours and almost 30 minutes. Can you believe that? I love it. I enjoy talking to you guys. Have a great night. I will see you guys on Friday, 8:30.